Okay, imagine this for a second. 1 minute you're seeing perfectly fine, and then just like that, bam, the vision in one eye just disappears. No pain, nothing.
It's incredibly jarring.
Right. And it's not just unsettling, it's actually a sign of a serious medical emergency.
Absolutely. That sudden, painless vision loss. That's the classic sign of something called central retinal artery occlusion.
CRAO.
hmm Think of it uh, almost like a stroke, but it's happening right in the main artery that feeds blood to your retina.
The retina being the light-sensitive part at the back of the eye.
Exactly. And when that artery gets blocked, the retina basically starts suffocating instantly.
And our sources really hammer this home. The clock starts ticking the second it happens.
It really does.
So today we're doing a deep dive into what central retinal artery occlusion is, why it's so critical, and maybe most importantly for you listening, especially if you're a patient or a caregiver, what the sources tell us about treatments, specifically hyperbaric oxygen therapy.
Yeah, and what's really striking in the materials is just how fragile the retina is in this situation. Those inner layers, the ones doing the heavy lifting for vision, they can be permanently damaged incredibly quickly without that blood flow.
So the experts are saying treat it like a brain stroke. Same urgency.
Precisely. Ideally, you'd want the same kind of rapid response protocols you see for stroke.
Okay, so the artery's blocked. The goal is obviously restore oxygen to that tissue before it's too late. How do the sources say we can even do that if the main pipe is clogged?
Well, that's the interesting part. The idea presented is to kind of bypass the main blockage by using a different blood supply system in the eye. It's called the choroidal circulation.
A secondary system?
Sort of. And if you could dramatically boost the amount of oxygen dissolved in the blood generally, that extra oxygen can actually diffuse across from this choroidal supply into those starting retinal cells.
Keeping them alive, potentially.
Hopefully, yes. Buying time, preserving function.
And that's where hyperbaric oxygen therapy fits in, getting that, like, super oxygenated blood.
Exactly right. You put the patient inside a special chamber with high pressure and pure oxygen.
Okay.
And under that pressure, the blood can carry much, much more dissolved oxygen than normal. The sources explain this creates a steeper diffusion gradient,
Pushing oxygen where it needs to go.
pushing it from the choroid into the retina, even without the main artery working.
Now, here's the part that feels really crucial, especially for anyone listening. The timing. The sources are really clear on this, aren't they? How fast does this need to happen?
This is, well, it's everything. The research we looked at indicates the best results, the best chance of vision recovery with hyperbaric oxygen happens when it starts fast.
How fast are we talking?
Ideally within 12 hours, maybe up to 24 hours after the vision loss starts. Some sources even mention the retina might only tolerate about 90 minutes of severe oxygen deprivation before damage becomes irreversible.
90 minutes.
Right.
Wow, that's barely any time at all.
It really underscores the urgency. You have a very narrow window.
So, acting fast is paramount. And the sources suggest if you do get treatment in that window, hyperbaric oxygen might help improve vision in around, what, 65% of cases?
Yeah, about 2/3, which is significant. It's a real chance.
It really highlights why getting to the right medical facility and quickly is just non-negotiable.
Absolutely. And the sources also mention, importantly, that while oxygen therapy is key, sometimes there's an underlying inflammation causing the blockage, like giant cell arteritis.
Oh, okay.
If that's suspected, then starting high-dose steroids right away is also critical, often alongside the oxygen therapy.
Good point. Two different potential problems needing immediate attention. And just briefly, accessibility-wise, did the sources mention cost for the hyperbaric treatment?
They touched on it. No formal big study cited, but they indicated costs might range somewhere between, say, $200 to $500 per session.
Okay, good to have a ballpark.
So pulling it all together, the message from these materials is incredibly clear. If you or someone you're with experiences that sudden, painless loss of vision in one eye,
Don't wait.
don't wait. Treat it as the emergency it is. Get medical help immediately, just like we think time is brain for stroke.
For this, it's time is vision.
Exactly. Time is vision. Every minute counts.
A really powerful takeaway that speed isn't just about getting help. It could genuinely be the difference between seeing again and permanent blindness. That silent, sudden darkness demands an immediate, fast response.